Hey, this is Doug Field, the CEO of the Institute for Healthcare Consumerism, along with my co-host, Brent Macy, and welcome back to this segment of Healthcare Consumerism Radio. We're very excited on this segment to have joining us one of our affiliate members and the CEO and co-founder of GoHealth, Clint Jones. Clint, good morning.
Morning, Doug. How you doing?
I'm going great. How are you doing?
I'm good. How was your holiday?
It was good. How's Chicago today?
It's not bad. We don't have any snow, and it's above freezing, so I'll take that for Chicago in December.
Except they're pretty sad about last night, right?
Bears are not having a good season.
Well, Clint, great to have you on the program, and it was great to have you out with us at IHC Forum West, and look forward to continuing to work with you in that regard. Give our audience a background on GoHealth, and then we'll get into the trenches here and talk about some stuff.
Yeah, absolutely. So GoHealth was started about 12 years ago. Myself and a college roommate actually started a small business, and a few months into that business, our parents encouraged us to get health insurance because we no longer had insurance coverage through an employer. And we went onto Yahoo Yellow Pages to try to find insurance, and it was just a really complicated process at the time. An insurance agent came over to our house and was offering to sell us a healthcare product, but we wanted to know how did that compare to Blue Cross and United and some other programs, because back then you could easily go to Travelocity or Orbitz or a travel site and compare American, Delta, or other airlines with a click of a button. So we said, hey, there's a real opportunity here to do that. So we embarked on that mission to bring kind of transparency in the health insurance shopping process years ago. And if we fast forward till today, obviously that the new law obviously is all around that whole mission as well, to try to help consumers find affordable health care. That's kind of where we how we got started, and ultimately with the ACA, it's really kind of folded in well with our mission and where we're going with our company.
So, Clint, I think you said it really well when you were out west and we were talking on the Defined Contribution Exchange panel. You was like, hey, where we are in this industry, and you said very clearly we're at the beginning, which I agree with. Talk to us about what you mean by that and where you see the market going over the next year or two, and how that and where GoHealth is going to go along the way.
Yeah, I think so. Obviously with the administration's mission of getting coverage for the 40-some million people that are uninsured, and obviously making a much kind of more efficient marketplace. I think that we're kind of moving in the right direction. Obviously, this is year 2 of open enrollment. Mm-hmm. The numbers last year are kind of ranging in the 7 to kind of 8 million people that got enrolled. And they're looking to grow that again this year. So I think we are in kind of the early stages of trying to identify what ways people are buying, bring in more and more transparency to the marketplace, making technologies and making access to care a lot easier. Then if you think about where the group market is going, a lot of times in the past, as an employee, you were given maybe 1, maybe 2 options, for a health insurance plan, and what a private exchange can bring to the table, or multiple options. It's not one size fits all. Employees would then have a lot of choice on the different plans that would obviously best suit their particular needs. And then from an employer standpoint, they obviously could put a set dollar amount in there that their employees could go and use those funds to buy obviously health insurance or other ancillary type products to help move that along. So I think that you're going to start seeing more and more adoption of these models in the future. I think right now, like you mentioned, we are in kind of the early phases. You've seen a few large organizations like Walgreens here in Chicago announced last year they were moving to a private exchange. But I think that'll become more and more readily available as becomes more kind of more of the norm as we move forward.
Yeah, and it just makes sense. I mean, if you're going to have consumerism and you're going to tell your employees that here's a fixed amount spend, you need to match that up with choice. That's what consumerism is. Give them choice and educate them on how to make the right choice for them and their families.
You're exactly right.
Clint, you had mentioned ACA here in this segment. How did ACA affect your business?
That's a great question, and there's obviously there's several elements of ACA that really impacts us and kind of our marketplace and the consumers that are looking for insurance. So obviously with the individual mandate and the requirement to buy health insurance or paying a penalty, those it kind of obviously expanded the market, and a lot of those folks that were kind of sitting on the sidelines or uninsured, now they have, they're kind of has a requirement to purchase. The other element of that, before ACA, carriers can underwrite you based on, previous health conditions and ultimately decline you or give you a rate up based on your personal, health profile. So that, now that that's out the door and it's a guaranteed issue marketplace, you have a lot of those folks that just couldn't get coverage in the past, that can. So obviously that, expands our marketplace. Everybody we talk to now, can get covered. Prior to that, I would say 30% of customers that came to us, ultimately got declined or couldn't get coverage because of a pre-existing health condition. So that's, obviously helped us out, helped our clients out. And then the other element of, a lot of folks that were uninsured just couldn't afford it. Their monthly premiums are too expensive and they couldn't afford the price. With the new subsidies and, the government giving those that can't necessarily afford it, access to care through tax subsidies, that expands, what we're doing as well. So some of those large changes really required us to kind of ramp up what we were doing. We ultimately made the bet that a higher percentage of people, as opposed to just going online and clicking a few buttons and doing a little research and buying, a lot of folks wanted to talk to somebody, even if it was for 5 or 10 minutes, just to ask a few questions or make sure that what the plan they've selected is the right fit for them. Or, hey, I want to verify that the medications I'm on are covered in this plan. I can see good discounts. Or, their primary care physician is in the network. A lot of those are, just a lot of people want to have the peace of mind that they made the right decision. Or if they simply don't understand some of the benefit designs or structure, we can explain and walk them through that. We really had to, kind of beef up our licensed agent count. We have more than 1,000 now in-house and 3,500 around the country that, sit down and work with people, whether it's over the phone or face-to-face to help them, understand what they're buying and make sure it's the right fit for them. On top of that, we had to invest heavily in a lot of online decision support tools that, customers could, walk through a process, selecting their primary care physician, entering a lot of data, really filtering down a plan that would meet all their requirements. So that's, kind of been where we're heavily focused on making the experience and the accessibility really, really strong. One thing we found last year as people enrolled, especially in the last couple weeks of open enrollment, there was a big rush to get enrolled and get covered so they, would avoid the penalty. And, what we ultimately found were people were they just wanted to get enrolled, but they don't really understand or didn't really understand what they bought. So, an education process of going back to those customers to really walk them through their benefits and explain those benefits. So there's really a whole post-sale, kind of consumerism piece to make sure that they fully understand the value of the plan they bought and, how to really access that plan and, save money, leveraging those benefits.
Clint, what's next for to help the employers with what they need to be embracing around the defined contribution and exchange model to serve their cost needs, their administrative resource needs, and then improve that experience for the employees and the consumers? So what's next for GoHealth?
Yeah, so we're really, you kind of hit the nail on the head. We're really focused on a couple different things here. One would obviously be, focus on, the defined contribution technology. There's a lot of folks that are looking at the really large jumbo groups. We think there's an underserved market in the kind of mid to small group marketplace where those employers are struggling to figure out, their cost structure. They want to, provide additional benefits to their employees. So we're heavily investing in technology in those areas, as well as on the back end post-sale, with, some telehealth features and giving access to consumers to really help make smart buying decisions and usage decisions around leveraging their health plan and understand everything that they do, how it impacts their bottom monthly line. And they're looking at that as well. And as kind of the cost of care gets more expensive, how do we put the right tools and transparency tools in the hands of consumers, really promoting consumerism, where they have an education behind every decision they're making, so they can ultimately make the right decision and save money in the long run, which ultimately will help save money at the insurance carrier side, So we're kind of building a true evangelism around, the entire marketplace.
Clint, when you look at, this open enrollment period that's taking place right now, is it going smoother than last year? About the same? What's your read on that?
Yeah, it's definitely going smoother. I mean, if we recall last year, there was the marketplace had some pretty significant technology issues during the first, call it 2 months of open enrollment. It went off without a large hitch this year. We were live, obviously, day one, enrolling people. Occasionally there's some small challenges, but I think it's a vast improvement from what we saw last year. We kind of came out of the gates with record numbers, and, compared to where we were last year, we kind of unfortunately underestimated some of the volume, which I guess is a good problem to have. So it's just continually to, add additional, resources and folks to help everybody looking for insurance out. But if I compare this year versus last year, it's kind of night and day.
Clint, a lot of us in this space see this as a pretty significant enrollment period as a validation that defined contribution and exchange is working, and I think you're going to see outcomes from different size of workforces, to your point earlier, that are going to, I think, surprise some people, and therefore leading to what many see as 2016, this coming fall, being the beginning of kind of a rapid growth period around defined contribution exchange. Do you guys see the same thing?
You're absolutely right. I think we thought it would take a couple years to get more adoption, and we're in pretty heavy discussions right now for like you mentioned, the 16 open enrollment for a lot of employers shifting that way, and where that goes. So with technology being available, I think you're going to start seeing more and more of employers looking at solutions in the defined contribution space. And I do think you'll start seeing some massive movement in the next year. We've got some pretty large partnerships we'll be announcing in the next 60 days around those fronts with some really, really large organizations that are going to be pushing heavily in this space. So we're really excited about that. And I think like you mentioned, once you see some big announcements like that, there's going to be a whole snowball effect, and everybody, every employer, every HR department is going to have to start looking at this and say, hey, is this a viable option for that business? And is it a value to the employer? Is it a value to the employees? And how do we move forward and make this work? So I think you're dead on there.
Clint, we got about a minute left on the program, and if you could kind of leave our audience with a couple key takeaways for what they need to be considering when they're looking at a option type or a solution such as yours.
Yeah, I think the biggest thing is thinking about every good market out there today has a lot of transparency tools and the ability to give your employees different options. So as an employer, you should be thinking about things like what can I provide my employees? It's a lot of different added value and benefits. And if you think about it, no plan, there's no one size fits all scenario here. So the more inventory, I guess, you can give to your employees and health insurance buyers, the better. So making technology easily available to those folks where they can kind of research and see what's online, and ultimately having that tied into a benefit advisor. So if they do have questions, they can get somebody live on the phone to walk through. Nobody's individual health situation is the same, and you need to give access to everybody in the way they feel comfortable buying.
Hey, Clint, we really appreciate you joining us on the program today. I hope you have a great weekend there in Chicago. And to the rest of our audience, please stay tuned for the next segment of Healthcare Consumerism Radio.